All right, so you'll need a chair for this morning. You're going to want your blocks, which you would already normally have. But I mentioned to some of you, I think all of you, that a foam roller could be handy. And if you don't have a foam roller, if you're needing to switch to something I'll explain later, you might just want a rolled up like beach towel, bit kind of larger sized towel. So we are going to start off sitting on your chair. We're going to sit on your Pilates ball. We're going to start affecting that pelvic floor right off the bat, and we're going to come into some breath. So get yourself situated so you can sit nice and tall, feet planted firmly on the earth, really sitting tall, crown of the head reaching towards the ceiling, no slouching. So on top of that Pilates ball on your chair. And then when we breathe, and in fact, if possible through this whole practice and forever, forever, the rest of your life, if you can start to teach yourself to keep your tongue suction cupped to the roof of your mouth. Of course, when you're talking, that's not possible, but the rest of the time, especially if we're really focusing on our breath and our posture, part of your posture is the placement of your tongue. So it's not pressing against the front teeth, it's not aggressive, but you think of just kind of suction cupping the tongue to the roof of the mouth. And that's where you want it will create more space to breathe. So you're going to have more space to get air in. But it is, as I mentioned earlier, a part of your posture. If your tongue is hanging back, it does affect your posture. It will affect your neck tension. If your neck tends to be tight all the time, it could be the placement of your tongue. It can also cause you to snore at night. Of course, it's more of a habit you'll have to develop during the day while you're awake, and then hopefully it crosses over to the night. So suction cup that tongue to the roof of the mouth. I'm going to stop talking here in just a moment. But once you do that, we're going to close the lips and breathe in and out of the nose. So suction cup. Okay, and that creates more space. And then deep breaths in and out of the nose as deeply as you can breathe into that lower belly and slow exhale. Big breath in. Keep that tongue on the roof of that mouth. Long exhale. Perhaps you pause at the top of the breath. Maybe one or two or three or however many counts feels comfortable for you. And then again, slowly you exhale. Flip it to the belly in. Maybe you pause at the end of the exhale. Keeping that tongue up there, suction cup to the top of your mouth, the roof of your mouth. Three more breaths. Maybe you're holding at the top and at the bottom. And then again, as long as you can remember to keep that tongue pulled up to the roof of your mouth, you'll leave it there. So I'll keep reminding you throughout the practice, but try to keep it there. So now we're going to move on to some movement with the body. Hands come behind the head. You'll round your spine, tuck your chin, exhale. Body moves back, rounding that upper back. And then you'll lift and lengthen and open through that chest wide through the collarbones. Ribs lift up, collarbones wide. Exhale, round, elbows move towards each other, upper back rounds, tuck the chin. Check that tongue, make sure it's still on the roof of the mouth, still breathing in and out of the nose. Lift, open wide through the collarbones. Body moves. The ball will probably be moving underneath you. Exhale, round. Inhale, lift and open. Let's do that one more time. Exhale, we round. Inhale, we lift and we open. All right, coming back to that neutral spine position. Step your feet wider, and you want to be forward enough on the seat that your legs aren't running into the seat itself. We're going to be doing some internal and external rotation of just one leg, pretty mild compared to what we do on the wall or on the floor, but just getting some movement into the hip. Notice I'm on the ball of my right foot. The knee goes in, it goes out. So just getting some movement in this right hip. The knee moves in, it moves out. Just rolling over the ball of your right foot to get the knee to roll in and out. A couple more times. 1 and 2, and then we do the other side. So a couple things happening, getting some movement in the hip, all the while we're still getting some myofascial release work underneath us on that pelvic floor. So we're a little multitasking here. Knee goes in, knee goes out. Check where your tongue is. Is it still on the roof of the mouth or did it fall back? It's normal. Most of us kind of live like that, but if we can keep that tongue on the roof of the mouth, our posture will improve, our neck tension will improve, our ability to breathe deeply will improve. All right, leaving the knee out now. Good. And just a little side to side with those hips. Hip shift left and right. So the ball will be moving underneath you. Again, getting some movement into the hips. It's like a little hula dance. Some of you might be able to do this a little easier than others. Don't worry, you're doing fine. Any movement is fine. Hip shift left and right. Getting some movement. I know that it feels probably kind of weird if you're not used to doing the hula. I'm not, but you're getting some movement in the sacrum, in the hips, the lower back. Couple more times, back and forth. Good. And then you can bring your feet a little closer together for a little bit more stability to do some flexion and extension of the lower back. So tuck the pelvis, belly button and rib cage move closer together, almost like you're doing a crunch, and then extend. So we did a little bit of that earlier, but this is more of a focus on the lower back. The upper back was more involved when we had the hands behind the head. And that ball should be moving underneath you. If it helps to use your hands on your hip bones, you can do that. The ball tucks underneath you, and then the ball moves front to back. So pelvic tilt, almost like a crunch, and then extend, lengthen, open through all of this. We'll do that a couple more times each way. Tuck, 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 and then extend those hips back. Tuck, tuck, tuck. If we are stuck in our hips, our lower backs will definitely suffer. So if this feels very stuck for you, you probably also tend to have some lower back tension and pain. Last one. All right, good. And then you can just bring your feet a little closer together again for a little bit more stability if that's more comfortable for you. Hands on the shoulders. We'll do some arm circles with the hands on the shoulders, elbow circles really. So circling around. Keep breathing. Where's that tongue? Is it dropping back or is it still on the roof of the mouth? Suction cupped up there. So check that. Couple more times. We switch directions. Okay, you could also take one elbow at a time. I like to do that. And then go the other way. We're getting a little fancy today. You can keep it as simple as you'd like. All right. Good. And then one more thing before we come off of this ball. So we're going to be stretching the forearm here. So reach the hand out in front of you, palm faces away from you, fingers down, and just pulling on the fingers, the bottom of the hand there. So you can grab the actual fingers or maybe a little bit of the hand where it connects to those fingers, whatever feels better, and then a little side to side movement. So hopefully you're feeling the wrist a little bit, fingers, and maybe even the hand. If you're pulling on the way down on the fingers, you're going to feel more on the hand itself. So maybe you start with your other hand higher and then move it to the fingers if that feels okay for you. We're going to flip that hand over so palm still faces you, but you've got the back of the hand away from you now, and or the fingers pointed down, back of the hand faces away. We'll go second side. So palm of the hand faces away from you, taking a hold of the hand or the fingers pulling down and a little movement side to side. Wrist, forearm, hand, fingers, all getting a little movement here. And of course, all the while underneath us, that pelvic floor is getting some attention. All right, flip it over. Fingers still point down, back of the hand away from you, pulling down, and a little movement here. Keep breathing, keep checking where that tongue is. Keep your tall spine. Try not to let your body slouch if you're starting to get tired of sitting on this ball. Sometimes we start getting slouchy, so check that you've got your good posture going still and let that go. Shake it off. All right, we're going to come off of the Pilates ball. We're going to take a single yoga tune-up ball. We'll start with your right side. We're going to be placing that ball right where your glute and your hamstring connects. You're almost on your butt, but not quite. I like to turn diagonal on my seat. I feel like I've got a little bit more room to move. Then I can use the back of my seat also to lean against. If I like, if I need more, I'm actually going to lean forward, maybe even lean on my thigh. So I need to get the amount of pressure on there that's appropriate for me. So I want to check and see, is it a 5 on a scale of 1 to 10? That's okay. We're really looking for a little bit more intensity unless it's an injured area. So if you're rehabbing an injury, back it off. So maybe more like a 5 or take it away from that exact spot. So if you've got anything super sharp, anything higher than a 7, too much on a scale of 1 to 10. And again, if you are rehabbing an injury, we're really looking for no more than a 5 in terms of intensity. Straighten and bend that leg, leaning on the leg to whatever degree you need. And then we're going to move the ball down. So a little bit down the leg, more towards the middle. If you're not feeling at least a 5, you probably need to make some adjustments as well. Ball might need to move up or down or left or right. Straighten and bend the leg, lean on it if you need more, lean away from it if you need less. Keep breathing, keep checking in. And then we'll move the ball down a little bit more. So closer to the knee. You might run out of room eventually on that chair, depending on the size of your seat. You might be limited here. Straighten and bend, straighten and bend. Maybe you're leaning on that leg a lot or a little. Do that a couple more times. All right, good. We're going to go right to side number 2. Maybe you flip around right there where that glute and hamstring connect. That attachment point can be a little tender, so make sure you're not overdoing it. Lean towards it if you need more, lean away from it if you need less. Straighten and bend, straighten and bend. And of course, if you have longer legs, you might not be able to do quite as big of a range of motion. You'll hit the ground if you have longer legs, so your range of motion might be smaller, or you could always sit on a bar stool or something like that that's a little taller. let's move the ball down more towards the middle of that hamstring. We straighten and bend, straighten and bend. Leaning in to whatever degree you need. This side probably different from the other side. That's normal. Let's do that a couple more times. Okay, and we'll move that ball down one more little bit. And again, straighten and bend, straighten and bend. Lean into it to whatever degree you need the pressure. Keep breathing. Where's your tongue? Is it on the roof of the mouth still? Couple more times. All right. Good. Okay. So we're going to go back to our first side and we're going to be coming to the outside of the IT band. So we're not smashing the IT band. So our IT band runs from the ilio crest, which is your hip, to the tibia crest, that's IT band. And what we want to do is get underneath it. There's an actual band here. We're trying to almost like tuck that ball underneath there. So what we're going to do is put it underneath us, but not completely. And then we're going to roll onto it. So I'm trying to roll my leg over the ball, if that makes sense. So I'm rolling, I'm pressing on it, and then I'm leaning away. I'm rolling up and over, trying to get that ball almost like tucked underneath that band of tissue. So we're not laying on our side and actually smashing that IT band. We're actually trying to get a bit underneath that tissue. And then we move it down. Same thing, rolling up and over that ball, using my own body weight from my hands pressing down on there to make it roll up and over that ball. It's like we're kneading that tissue, softening that tissue. All right. If you've got room to move it down a little bit more, you'll go ahead and move it down a little bit more. If not, just stay where you are. Rolling up and over that ball, up and over that ball. Couple more times. All right, and we are on to side number 2. So flip it around if you're sitting sideways. And again, it's not all the way in the back. It's not on the side. It's just kind of poking out. So it's still underneath us, but you can see it. It's not completely underneath me. I'm going to roll up and over, leaning and rolling up and over that ball. This can be pretty tender for some of us. So check in. You want to make sure that you're feeling it, but it's not too much. All right, let's move that ball down a little bit, more towards the middle. Good. All right, one more little bit down that leg if you've got the room for it. And then we roll up and over. If you've got knee issues, you're probably really feeling this, particularly as you get closer to the knee. A lot of knee pain comes from a little bit over tense, over tight, stuck IT band. Doesn't mean you should smash that IT band with a foam roller. I am not a fan of going directly on top of it and smashing it with a foam roller. If you've got inflammation in there, that's just going to make it worse. But this sort of getting underneath it, sideways approach, sneaking it in and underneath there can be extremely effective. Couple more. Roll up and over and roll up and over. Okay, good. Okay, so set that ball down. We're done with that for now. And you're going to be sitting on your chair, a little bit forward on your seat. We're going to be working a little bit of movement into the side body here. So I like to hold the chair with my hands so I don't tip over. Take your feet a little wide and you're just lift up and over and lean. So we're stretching this side body. If it feels better to put your hand behind your head, that's fine. And again, wider feet. If you feel like you're going to tip over, you could put your hand on the seat or even come onto your own leg here. So think of length through this side body. We're not trying to dump over here. So it's like up and over. So more space on this side. And then we lengthen through that right side body. And if that's not enough for you, you could start reaching towards the ground. Some of you might be able to reach the ground. Maybe even if you put a hand on a block. So your options: hold the chair, lean on your leg, hand on the floor or on a block on the floor. We've got 3 more big breaths. And again, the arm can be straight or bent. 1 more breath. And then if you have your block on that side, you can bring it up and over to the other side. Or if you have 2 blocks, hopefully one is just right there ready for you. All right, so we have our choices: hand on the seat, arm can be up and over straight, hand could come behind your head, you could lean on your own thigh. And if none of that feels like it's enough, maybe you reach for the ground, set that block on whatever setting. This side's a little tighter for me. I'm gonna have to put it on a higher setting to start anyway. My left side is definitely less flexible today for whatever reason. Who knows? But you always want to check in. I don't want to assume it's the same. That's all about this process of paying attention. Check your tongue on the roof of the mouth. Maybe closing your eyes will help. 1 more big breath. And we carefully make our way up out of that. Okay, so we're going to be standing now, and you want your seat of your chair facing you. And what we're going to be doing here is using the block. We're going to have 1 foot on the block. Our hips are going to be offset. This will be very helpful if you've got some issues going on with your hips, your pelvis, your sacrum, and even just the lower back itself. So 1 foot is on the block, and I'm going to have my feet hip width distant at least. Actually, I'm going to switch so you can see what's happening with this foot that's on the block. So I'm putting my left foot on the block. It doesn't matter. We're going to do both sides. And then I'm going to bring my hands to the seat. I'm going to do a check-in and notice, do I feel anything? Not really. Some of you will feel a lot. You're going to start straightening this left leg. In fact, I'll show you from this direction so you can see also. So I'm going to start straightening this left leg to the degree I can straighten it. So it may or may not go straight. And then once I have that, maybe that's enough. So mine's actually going pretty straight. Some of you will need more, and that means you bring your forearms down to the seat. Now that's going to start getting pretty intense on the leg of the foot that's on that block. Okay, so again, this leg might bend a little or it might be straight. You're trying to move it in the direction of straight. And it doesn't mean it will go completely straight, but that's what you're going for eventually. And we're going to hang out here. So the foot that's on the block, that probably is pretty intense on that side. The other leg, not a lot going on for me. You might feel some, but some of you won't feel anything on the foot that's on the floor. And then you're just going to start to shift your hips right to left. Doing a lot of dance moves today. Hips right to left. You'll notice the intensity increases when you move the hips towards the foot that's on the block. Keep breathing. Keep checking in. Couple more shifts right to left. And then we're going to come up off of the block, off of the chair. Just come all the way up, separate your feet about hip width distant. Just going to take a little mini standing Shavasana, which is actually called mountain pose. Close your eyes, feel your feet rooting into the earth, check where your tongue is. Can you lift the crown of your head even taller? Can you get your shoulders back? Can you work on that nice postural alignment as you breathe? All right. So we're going to switch sides. So move that block over. Other foot's on the block. And again, as about hip width distant, it can be even wider. And I would start with, before you start trying to straighten the leg, you're going to put your hands on the seat and then start moving the whatever foot's on that block in the direction of straight. Maybe it goes straight, maybe it doesn't. It doesn't matter. You're just trying to work into that direction. Some of you will need to bring your forearms down to that seat. And then we breathe. My toes are in the same line, so I'm not bringing this foot back here. If I need less, I'm just going to widen my feet a little bit and maybe not straighten my leg as much. Try to keep the toes in alignment here. And start to shift the hips right to left. Keep breathing. Couple more shifts. Right to left. Right to left. And then we carefully make our way all the way up. Finding your, again, standing Shavasana, mountain pose. It's a reset. Ground through your feet, tall through the crown of the head. Good. Okay, so we're done with the block for now, and we're going to be bringing ourselves into a crossed over foot position. Doesn't matter which one's in front, you're going to do both. So we're going to go here. So I'm going to cross my right foot over. Okay, so both feet are on the floor. And then we're going to reach for the seat again. So front knee can bend or it can be straight, whatever's more comfortable for you. But the most important thing is that you're feeling something in the back of your leg, of the back leg. For me, that's my left leg. So we're going to bring our elbows down if we need more. If we need less, we bring our hands to that seat, or even put blocks on that seat to bring it up a little bit more. Okay, do what you need to do to take care of yourself. Couple more big breaths. And start to make your way up. All right, so if you're on the same side as me, my right foot is in front. You're going to be leaning over to the right. So if you're on the opposite side, you'll go the other way. So my right foot is in front. I'm going to reach my right hand down towards the ground, left hand behind the head. If you're on the other side, you just switch it. Okay. But if you're on the same side as me, right leg is in front, right hand reaches towards the ground, left hand behind the head. Hips are going to shift a little bit left in my circumstance. If you're on the other side, they'll go the other way. Length, not dumping, reaching. Couple more big breaths. And we lift up and out of that. So we'll switch the legs. So if you're doing the same side as me, your left foot will now be in front, right foot behind. Try hands on seat. If that's not enough, bring the forearms down. Front leg can bend. It could also move in the direction of straight, which will intensify things, but the back leg really needs to be quite straight. Let's do a tongue check. Relax your neck, your shoulders, your jaw, your face. Remember, your hands could be on the chair. If the forearms don't reach, they could also be on blocks if you're having a difficult time reaching the chair. Three more breaths. And then we'll start to make our way out of that. And you can still face the chair for this. If you're facing the chair, it's fine. I'm going to turn away so you can see me. If you're on the same side as me, it's the left hand reaching down, right hand behind your head. And remember, I'm lengthening up and over. So I'm not just dumping over. I'm thinking of length and length, reaching long. So I want to get a lot of space on this right side. And if you're doing the other side, of course, everything will be the opposite. Three more breaths. And we slowly make our way up and out of that. All right. So we are done with the chair. You can move the chair out of your way. We're going to start moving on to the one where I said you might want a foam roller. You might need a rolled up towel. It's possible an extra yoga mat could be handy for part of this. I will show it to you and then you will make your adjustments. I'll give you time. The first and most intense version or option of this is to use the block. There's corners on your block, of course, so that's going to be more intense than a foam roller and certainly more intense than a rolled up towel. We're going to start with the block on its flattest setting if you're using the block. This is a big stretch in the ankles, and you're also going to be feeling something from this block when we put it back here on your calves and your hamstrings. Try it. If it doesn't work, maybe try a foam roller. If you don't have a foam roller, a rolled up towel, you're not going to get nearly the intensity on the calves and the hamstrings because of a towel is soft, but you're going to still get this stretch in the front of the ankle. So I've got the block right now on its flattest setting. My feet have to be pretty close for this. Otherwise, I won't be able to, the block won't really fit in there. I'll lose the block underneath me. So right now, what I'm feeling is a stretch in my ankles. Some of you might need to lean a little forward if that's too intense. A big stretch in the ankles. I'm also feeling the block, corner of the block, doing a little work on my hamstrings and my calves. So a few things. If the ankles will not bend that much, you could try putting a couple towels or an extra yoga mat right there like this. So I've got that right underneath there. If it's killing your knees or the block is too intense, you could try a foam roller. And right now I do have the block or the roller pretty close to my ankles. Okay, so foam roller might work. If you don't have a foam roller, as I mentioned earlier, a rolled up big, kind of bigger size towel, something that would hopefully be almost as big as this, would be an option. So once you've done that, once you've made your choice, let's go ahead and find your seat, stretching the ankles. Even with the foam roller, I'm feeling the pressure of the foam roller on the lower part of my calves and the upper part of my hamstring. I am going to move the block or the foam roller forward eventually. So make your choices. Please don't hurt your knees if it's too intense on the ankles. Don't be afraid to use either an extra yoga mat or just even a small rolled up towel will decrease the intensity right at that ankle. Okay, so you could stay still. You can move side to side. Again, some of you are not going to be able to sit upright, so you can either slightly lean on your legs or a little block in front of you like this. So if you do have the block underneath you, we're going to try on the medium setting in just a moment. If you have the roller, you could try just moving it up a little bit, which I'll show you in just a second. So hopefully you're getting a little bit of something here. You found something that works for you. All right, so block on this setting now. So you're going to need to make sure that you're adjusting things so you don't fall off your block. So this will increase the intensity in every way, having it on the setting, more pressure on the ankles, on the top part of the ankle, also the Achilles tendon part. I'm still feeling the pressure of the corner of the block underneath me a little bit on those hamstrings. And if by any chance you have a wooden block, this is way more intense. And then if you're using the foam roller, again, just a little adjustment, try it a little higher, just a little slightly different position. If you're using the towel, you could try adjusting where the towel is as well. And again, you can move side to side or stay still. Don't be afraid, again, to try some different things, see what works for you. Some of you will be upright. Some of you, no way, your hands are going to be on a block or maybe even on your thighs or on the floor. It's pretty intense. We need to keep mobility in these ankles and calves. Super important for overall postural alignment. As soon as we lose the mobility in our ankles, the whole system goes goes downhill. So at that point, now we're going to have knee issues, hip issues, back issues, even neck issues if we don't have mobility in our ankles, if we've lost it. Keep breathing. You have 5 more breaths. Make sure your tongue is on the roof of the mouth. And one more big breath. Okay, good. Okay, well, I hope you enjoyed that new little adventure. If you have questions about it later, please let me know. Happy to help. We're going to move on to a belly massage. So go ahead and grab your Pilates ball. And you could also use a foam roller for more intensity, but we'll start with the Pilates ball on the lower belly, pretty close to the pubic bone might be crossed just a little bit, which will work with the Pilates ball, not so much if you have a foam roller. But it's really low. Part of it's on my belly button, and maybe a tiny portion of it on my pubic bone. So quite low. I'm just going to breathe here for starters. You can be upright, or if it's more comfortable for you to be down, you can be down. Maybe even if you have your towel, you can roll it up and put it under your forehead. Deep breaths. 3 more breaths. And if your forehead is down, go ahead and lift up onto your forearms and move your hips right to left. So that ball will travel a little back and forth across your lower belly. All right, you're going to remove the ball. So separate your feet as wide as your mat. We're going to move into something called Sphinx. So start with your forearms on the ground, maybe in front, maybe even a little bit in front of your shoulders or right underneath your shoulders if that feels okay. But then you're going to press down and it's almost like you're trying to drag your body forward. So what you want to feel is a stretch in the front of the body, not a pinch in the back. So if you're feeling a pinch, you probably lifted too high. If you need more, you can press up a little more. Farther away the hands are from you and elbows are from you, the less intense. Closer they are, the more intense you will feel. And then press down. It's like you're trying to drag your body across the floor. Pull the shoulders down and back. Maybe you let your head drop down. You could move it or it could be still. You could do some circles if that feels good in your neck. And again, your feet are on the wideish side. They're out straight behind you, but definitely as wide as your mat. Keep breathing. And then lower down, support your forehead, bend your knees. Your knees are wide. Windshield wiper side to side. And relax the legs. All right, the ball is going back underneath you, or you could try your foam roller. Okay, foam roller, much more intense. Try it. If it doesn't work for you, you just don't do it. You go back to the ball. No give or not much give, depending on your foam roller in this. So it can be a little too intense for some of us. So ball is fine. If that's what works for you. If you have a less dense foam roller, this might be fine also. You're going to breathe deep. So again, really quite low. It's right at the portion of it is hitting my hip bones right now. Obviously, can't go all the way down to the pubic bone area, or not very easily, depending on how dense your roller is. It'll be uncomfortable on the bones if you're too low and the roller is too hard. So just make good choices. And then if you're on the roller, obviously you're not going to be able to move the roller, but you can just kind of move your body side to side. So it kind of grabs the tissue and then you move your body. It's grabbing the tissue as you move side to side. This can be really intense. We can start clenching our jaw, forgetting the breath. So come back to your deep inhales and exhales in and out of the nose, tongue on the roof of the mouth. Okay. We'll come off of the ball or the roller, set it to the side. Just take a little moment on your belly. And then we're going to come back to the Sphinx posture in just a moment. So you're going to move your feet closer together and turn your toes in towards each other. So the ankles are rolling out, toes are facing towards each other. The feet are a little closer together, maybe about hip width. If that's not comfortable when you come up, then try wider again with your feet. Bring those forearms to the earth, pressing down, and it's like you're dragging your body forward. So it's like I'm trying to drag my body across the floor. I'm not dumping into the lower back. I definitely don't want to feel a pinch back there. Deep breathing. Your neck can hang, it can be up, whatever feels good for you in this pose here. All right, relax. So your knees will be closer together now for this windshield wiper. Couple more times. And we'll let those legs relax down. You're going to bring your hips in the direction of your heels. Go ahead and separate your knees quite a bit, though. Maybe it's a true child's pose, or perhaps it's more like puppy dog. Just giving your back a moment to relax, whatever feels like it's restorative for you. And then we'll start to walk both hands to the left corner of your mat and really reach that right arm. Sit your hips over to the right for a little bit more of a side stretch. And we switch sides. Aiming towards the left corner of the mat, right corner of the mat, excuse me, and really reach the left arms. We're aiming to the right corner, left arm reaches. Sit the hips a little to the left. Okay, very good. All right, so you're going to be coming onto your back now. So you're going to find your block. And your strap. The other option is to actually use your foam roller. Your foam roller, if you have one, is going to lift you higher than the block. So the block is that thick and the foam roller is that thick. So you can try the block if you want to try the foam roller. Just be careful it doesn't roll out from underneath you. So if you're using the foam roller, it looks like that. It's on my tailbone. If you're using the block, it looks like that. It's on my tailbone. So I'm going to use the foam roller. I'm going to go for a little bit more intensity today. You can as well if you'd like. Go ahead and extend your left leg out and bring your right knee into your chest. If you're on the foam roller, be careful it doesn't roll out from underneath you. If it's not working, just go ahead and use that block. So it's a little bit more precarious because it rolls. So you make a good choice for you. If you feel comfortable with the roller, use the roller if you have one. And then if you don't, of course, use the block. Knee into the chest, that left hip flexor, you should be feeling that. The top of your left thigh where it connects into your hip. That should be quite intense. The more the hip bones are tipping towards you, the more intense you will feel the stretch, that passive lengthening of your left hip flexor here. And then go ahead and grab the back of your right leg and we move the right leg in the direction of straight and then rebend. Probably will not go all the way straight. Just moving in that direction. Keep your thigh as close to your body as you can. You want to add in the flex of the ankle at the top. You can do that and then you point and then you rebend. So as the leg extends, the toes are pointed, the top, flex the ankle, and then rebend. Point, extend, flex, and bend. Point, extend, flex, bend. Two more points, extend, flex, and you bend. Okay. So left leg rebends. If you need to do any adjusting, adjust that roller or your block. The right leg, we're going to be working on it again. You're going to catch your foot with your strap. So the left leg, that knee is bent. It's pretty solid on the floor, but maybe not so bent because you don't want to run into it when we start to take this right leg across to the left. The right leg is as straight as your body will allow. So that might mean It's not as close to your body as it was before, but keep that right leg as straight as you can. Pull the toes back towards the shin. Hold your strap with your left hand. Take your right hand out so you don't fall off your block or your roller. The right leg is going to move a bit to the left. It's probably not going to go very far. You're going to feel something likely anywhere along the line of the outside of this leg, maybe the back of the hamstring on the lateral side. Make sure you're not tipping over. It is not a spinal twist. This is me showing you what we're not doing. Okay, you're not letting your body completely roll over. So if you're doing this correctly, where you should feel is out here somewhere. If you want to increase the intensity, you're going to internally rotate that ankle. So I'm pulling on the inner part of this strap so my foot turns. That is going to increase the intensity. That may or may not be appropriate for some of you. It's going to be too intense. So holding that as long as it feels tolerable, it might even be a burning sensation. This is a nerve stretch, so it can be quite intense. Check your breath. All right, coming back to center. Lose the strap for now. And we're going to switch sides. Left knee into the chest, right leg is out. Pull that left knee as close as you can. Right thigh, hip flexor is what we're experiencing here. Passively lengthening here. Check your breath again. Taking a hold of the back of your left leg, we move that left leg in the direction of straight and then rebend. Hold the thigh as close to your body as you can. Option to add in the flex of the ankle at the top. Point as you extend, flex, and then you bend. Point, extend, flex, and bend. Point, extend, flex, bend. One more time. Point, extend, flex, and bend. Rebend the right knee. Strap goes to your left arch of your foot. Extend your leg up to the degree you can to try to keep the left leg as straight as possible. Pull those toes back towards your shin. Hold the strap with your right hand. It goes over to the right. I've got my left hand on the ground over here to my left so I don't fall off my roller. And then remember, you could internally rotate this foot and ankle by pulling the inner part of that strap down. That may or may not work for some of you. And remember, this isn't going to go very far. If you're feeling it in your back, you've gone too far. Deep inhales and exhales. One more. And we slowly come out of that. Set the strap off to the side. Extend both of your legs out. And to whatever degree you can, both of your arms back. If out is more appropriate, you go out, but if possible, the arms go back. Take 5 of your biggest breaths. 3 more. After your last breath, rebend your knees, step your feet wide, and windshield wiper side to side. And then engage the core to lift up and off of your block or roller. TP your knees towards each other. Biggest breath yet. Hold the breath for 4, 3, 2, 1. Open your mouth and let it go. You can stay here if that feels best for you, or you can take a more traditional Shavasana. Legs extended if you choose. Thank you for joining me. Namaste, my friends. Have a great day.